RBC Variations. Fox College. VT 134. Clone Lab 3. Schistocytes. Schistocytes are irregular fragments of RBCs that have been damaged during circulation. They often appear in bizarre forms. Classically, they are a hallmark of fragmentation. They usually occur with microangiopathy. Microangiopathy, also known as microvascular disease, or small vessel disease, is a disorder affecting small blood vessels in the body. Schistocytes are seen in disseminated intravascular coagulation, hemangiosarcoma, glomerulonephritis, heart valve abnormalities, and severe heartworm disease. Here, numerous schistocytes can be seen in many conformations. Acanthocytes. Acanthocytes are also called spur cells or spiculated cells. They are characterized by irregular surface projections. It is believed they form due to excess cell membrane, with too much cholesterol, and insufficient phospholipid. Although there are numerous reasons for their appearance, as you can read on the slide, the most common reason they appear are with liver disease and kidney disease. They should not be confused with echinocytes, also known as burr cells. Echinocytes are crenated red blood cells that have projections which are evenly distributed around the cell. Here you can see numerous acanthocytes. Notice their irregular surface projections. More acanthocytes. Here, by comparison, are echinocytes, with more regular surface projections. Keratocytes. Keratocytes are indicative of RBC injury. Keratocytes are present in many of the same conditions that cause schistocytes. They also often present concurrently with Heinz bodies. Keratocytes are not considered to be pathological, if present in low numbers. Keratocytes are often formed when fibrin strands are precipitating out, as might occur when an animal becomes hypercoagulable. Picture an array of fine fibrin strands that an RBC is rushing towards. When it hits a fibrin strand, the edge of the cell gets sheared off, creating this appearance. A couple keratocytes, seen up close. Autoagglutination. Autoagglutination refers to clumping of RBCs. Autoagglutination can be an artifact seen when a drop of anticoagulated blood is placed on a cold slide. However, assuming the slides are at room temperature, autoagglutination seen when mixing 1 drop of blood with 1 drop of saline on a slide is very likely diagnostic for immune-mediated hemolytic anemia, also known as the abbreviation IMHA. Autoagglutination, as it appears on the slide. The factor causing the RBCs to clump are the patient's autoantibodies they form against their own red blood cells. Spherocytes. Spherocytes are thickened, dark staining cells, with no central pallor. They are typically smaller in size than normal red blood cells. We worry about spherocytes appearing on a slide because they are characteristically the hallmark sign in dogs with autoimmune hemolytic anemia. They are occasionally seen in other diseases that damage the red blood cell membrane. Spherocytes. Notice the cells lacking the central pallor. Target cells, leptocytes, or codocytes. These are all birds of a feather. The same cell, but with different names. Target cells are thin, cup-shaped RBCs with a dense central area of hemoglobin, separated from the peripheral, hemoglobinized region by a pale zone. They are sometimes created just as an artifact of drying. Basically, target cells have too much membrane, and too little hemoglobin. Target cells are seen in regenerative anemia, cholestatic liver disease, iron deficiency, and with hypothyroidism. Target cells. You can imagine that Cupid, Robin Hood, William Tell, and, of course, the Green Arrow, all would have loved these cells. Metaerythrocytosis. Metaerythrocytosis is defined as increased nucleated red blood cells in the circulating blood. Hypochromasia. Hypochromasia is due to decreased hemoglobin in red blood cells. This creates cells with an exaggerated central pallor. Heinz bodies. Heinz bodies typically indicate a toxic change in red blood cell hemoglobin, resulting in precipitation of the hemoglobin. The precipitated hemoglobin then appears on or near membrane edges and targets these cells for destruction by the spleen. Common causes include acetaminophen toxicity in cats, and onion or garlic toxicity in dogs or cats. In this slide you can see several unstained Heinz bodies. Heinz bodies are always easier to visualize if they have been stained with new methylene blue, as seen in this slide. Polychromasia. Polychromasia is the appearance of larger red blood cells with a bluish tint. These cells are immature, and still contain some organelles which cause the cytoplasm to stain a blue color. When seen, polychromasia indicates regeneration. Mycoplasma haemofelis. A cat becomes infected from a bite from an infected flea, and soon, the cat's red blood cells are covered with free-floating Mycoplasma organisms. Mycoplasma haemofelis will appear as small, short, rounded rods, alone or in chains, on the surface of red blood cells. Visible parasitemia can, in effect, vary greatly from day to day, even hour to hour. Mycoplasma haemofelis may therefore be difficult to detect. Caution is needed when submitting a sample of suspect feline blood to the laboratory for diagnosis. Why? Mycoplasma haemofelis will detach from the red blood cells in EDTA tubes, so, if suspecting the parasite, one must make slides prior to putting blood in EDTA tubes. Other infectious agents can be found in red blood cells but are usually very difficult to see. These include Babesia canis, a large oval to pear-shaped parasite, and Anaplasma, a disease-causing organism in dogs and cattle. Mycoplasma haemofelis, as seen under the electron microscope. In the image on the left, you can see the little organisms on the surface of the red cells. In the image on the right, you are seeing a single red blood cell, up close and personal, coated with a parasite. Mycoplasma haemofelis, as seen with standard light microscopy in a standard blood smear,